So let's go ahead and just do a head-to-toe examination. Again, I'm not expecting to find anything groundbreaking here. I just want to do a general assessment just to get a sense of how your overall health and well-being is. And so I might ask you some questions along the way, if that's okay. Okay, so let's start at your head. Please just sit, relax. Yep, I'll just come behind you and just feel in your scalp. I'm just feeling. Yep, your hair is nice and healthy. And if you do experience headaches, where do you generally feel it? In your forehead, in your temples, near your nose, in your eyes, top, back of head, where is it localized? Okay. Okay. Yeah, that makes total sense. I'm just going to feel around your temples, your face. Just relax your jaw. Do you ever get any tension in your jaw? TMJ? Yeah. Any stuffiness? Runny nose? Sneezing? Any allergies? Okay. And I'm just going to take a look into your eyes. So you could just look forward, please. Just checking your pupil response. Okay. Great. Does that hurt your eyes at all? And how are your eyes? Do you feel like they're dry, red, any pain or pressure? Okay, I'm just going to feel your eyes just to hold them closed for me as tight as you can. Don't let me open them. Okay. Did that hurt at all? Okay. Do you find that your eyes get more tired in certain situations? How do they respond to light? Are you okay with bright lights? Any specific lights, like LED, fluorescent? How are you with soft lighting? How about with screens, laptops, television, phone? Experience any eye fatigue with that? Yeah, okay. How about in the dark? Can you see okay in the dark? Okay. Have you had an eye exam recently? Okay, good. I'm just going to take a look into your ears. I'll check your other ear. Okay. And I'm just going to rub my fingers together and let me know if you can hear them. Can you hear that? Okay. How about this? Good. Good. Any trouble with your hearing? Clogged ears? Anything? Okay. If you can open your mouth, please. I'm just going to take a look inside. Stick your tongue out and say ah. And again. Okay, thank you. Have you experienced any sore throat, hoarseness, any frequent colds or illnesses, respiratory-wise? Yeah. When you do get a cold or the flu or anything, how long does it usually last? Okay. Alright, I'm just going to feel your neck. I'm just feeling your lymph nodes, thyroid. If anything's tender at any point, please just let me know. Okay. And I'm just feeling into your shoulders now. Do you have any tension in your neck and shoulders? Is this where you hold it? Yeah. Okay. I'm just going to listen to your heart now. Please just breathe normally. How is your heart? Do you feel like it generally beats normally? Or do you have any heart palpitations, fast heartbeat at any point? How is it when you exercise or do any movement? Okay. How about your breath? Do you ever get out of breath when you're climbing stairs or doing any moderate exercise? Okay. Can you just take a few deep breaths for me? In and out. Again, in and out. One more time. In and out. Good. You're doing really good. I'm just going to feel down your spine. Any back pain? Okay. Okay, I'm just going to feel down your arms now. Any tension here? Yeah. Do you work on the computer a lot? Yeah. How's your wrist? Okay. Can you hold your arms out for me? Straight out? And close your eyes. Don't worry, I won't let you fall. Just keep your arms up. Okay, you can open your eyes and put your arms down. Okay, I'm going to check out your legs now, so just relax. You can stay seated. Any knee issues? Okay. Just going to check your reflexes. Just relax. Okay, check your other leg. Okay. And lastly, your feet. Can I take your shoes off? Sure, no, just stay seated. I'll do it. I'll just take your socks off. I just want to take a look at your feet. Alright, I'm just going to take my cold instrument, just run it up your feet. Okay, good. Looks like they curl. Does that feel cold to you? Okay. Alright. You can put your shoes and socks back on. Okay. Alright, everything feels okay. So, here's what I would like to do. I'm going to send you for a series of blood tests just to get a sense of your vitamin levels, your white and red blood cell count. This is just to give me more of an indication of what's going on inside you. In the meantime, while we're waiting for that, I have a couple of suggestions that I know that have helped others that you can try. So, as you're probably aware, we are still looking into medical treatments for these long haul issues. And as we continue to research and develop treatments, I will keep you informed every step of the way. Now, some people have had marked success with alternative and complementary treatments. And I'm a holistic practitioner, so I believe that anything we can do, mind, body, spirit, to help you feel better is going to be truly valuable. So these blood tests and the tests that have been run for you in the past, this all gives you us an idea of what's going on inside physically and what we medically can do. But I also recommend that you look into some complementary or alternative treatments to help. So one of the things that we've noticed with a lot of people experiencing similar symptoms and issues like you are is that stress exacerbates the symptoms, right? Stress makes them worse. It affects our mental health, stress about the disease, stress about our own health, feeling like we're inadequate in some way. I want you to do all you can do to find ways to manage your stress. So some things you can try that have helped others in similar situations include massage. Massage can help release some of the muscle tension that you've been experiencing, find an overall sense of relaxation. Now, because I am prescribing it as a medical doctor, you can get your insurance to pay for it, right? That would be the first script that I'm going to be writing you, a recommendation to see one of our massage practitioners. You can also go to somebody else if you prefer, but they are really great massage therapists here. The second thing that I would recommend to you is to also find ways to incorporate light exercise or movement into your day. Now, oftentimes when I say this to people who are dealing with these long-term fatigue issues is that exercise can seem overwhelming. But what movement can do, even small movement, like a gentle walk, some yoga, light stretching, is it can help bring feelings of well-being. It releases endorphins. It can also promote relaxation and stress relief. So the second script that I am giving you is a script to see one of our physical therapists. The physical therapist at our clinic can help prescribe you a series of gentle exercises that you can try. And they're going to give you things that you would enjoy doing. So they'll have a conversation with you, determine what exercise would best fit into your schedule, what you would most enjoy, what you can make part of your life cycle. But it's really important that you start slow and gradual because we want you to feel good. We don't want you to get on a strict regimen that you feel is not sustainable. We're all human. Not everybody exercises every day. That's okay. We're going to start small, even if it's 10 minutes, 3 times a week. Then that's where we start. So the physical therapist here will help outline a plan for you. Does this sound good so far? Anything make you anxious about this? Okay, just want to make sure. So when we get your blood test back, we'll see how your vitamin levels are. Some of what I've seen in long haul patients is that some vitamin levels are off. You may need more iron. You may need more magnesium. You may need something else. We're going to see where you're at and then experiment with seeing if we add some vitamins into your everyday regimen, if that helps you feel improvement in sleep or your fatigue or any of your other symptoms. But again, we'll take it slow. We'll add one thing at a time. if it's needed, and we'll work out a plan. Okay, I'm not one to just throw vitamins and medicines and supplements at you. We'll do it with a very concrete purpose, and continue it only if it helps. Yes. I know that oftentimes with a lot of medications, there are a number of side effects. And with everything you're experiencing, I don't want you to have side effects on top of it. So vitamins are a natural way to help with some of this. And then if we do determine to have biomedical treatment, we'll make sure we can find things that are suitable for your body and doesn't cause too many side effects. Yeah. Yes. So we talked about massage. We talked about physical therapy. Mental health is also something that I think absolutely needs to be addressed with those experiencing long-haul symptoms. This is an incredibly difficult situation that you're dealing with. Many people who have long-haul symptoms experience a form of PTSD, not just from initially getting sick, but all of the stress and uncertainty around the illness, all of the people who have dismissed them. We also know from COVID and some other long-haul diseases that depression, anxiety tends to be increased. We want to help you make sure that you are finding ways to deal with any negative emotions you're experiencing. If you're dealing with any anxiety, depression, insomnia, I want to make sure that you get help. I also think that even if overall your mood is good, that because you're dealing with what I would call an invisible disease, that it's helpful to talk to somebody about it. Not just a professional, but others that are experiencing similar issues, so that you feel like you have a support group, people who you can identify with and you can be completely open with and not feel judged, but feel respected and accepted. So we have an entire mental health system, part of the Hope Clinic. My third script will be to recommend that you see a therapist or counselor if you aren't already. You can choose. We have a number of different professionals. Sometimes it takes a few sessions to get used to somebody, and if you find that that person isn't the right fit, we'll match you up with somebody else. No harm done. Yes, so what I'm going to do is send you over to the clinic. You can fill out their general questionnaire. You can be matched with a therapist or counselor that fits your needs. You also have some say in who you pick. So if you prefer a certain gender or a certain level of specialty, you can certainly have a say in who you would like to work with. In addition to individual counseling, I also recommend some group therapy. A support group meets once a week. You can attend as often or as little as you like. Again, these are all suggestions that would be covered by insurance, so there shouldn't be too much out-of-pocket expense for you. But if any of these would be useful, and I think that they could be, I recommend that you take advantage of them. So like I said, the group support group, they meet once a week. They have a virtual and an in-person option, depending on what works best for you. How does that sound? Okay. So I've given you a lot to think about, going for massage, going for physical therapy, and going for some mental health support. We have other options at the Hope Clinic that you can also do if you're interested. This includes chiropractors, occupational therapists, we have acupuncture. But for now, I want you to start small. Start with some of these recommendations. Even if you just start with one right now, that is okay. I'm going to see you again when your blood tests come back. We're going to go through them together. We're then going to see what our plan of action is, and then we'll set up a continuity of care. which means that I want to see you regularly. I don't want you to feel that you've been dismissed and now you're on your own. I want you to feel like you have a team of professionals that are set up to support you and help you through your wellness journey. Because that's what it is. It's a wellness journey. It will take time, that we are here to help you in any way you can. So we're going to set up regular meetings. We can do them virtually or in person if you prefer. These will be check-in meetings, seeing how things are going. I'll be your touch point. So I'll be the person that you can come to if you're having any issues with the other care professionals that I'm assigning to you. If you have questions, if you want to change who you're working with, that's all fine. I'm essentially not only your primary care physician, but your case manager. So I'll make sure to coordinate all of this and keep you informed. We have a portal where we can communicate with you in between meetings. You'll see your schedule of appointments. You'll see again, like all of this will be submitted to your insurance. It should be covered 100% under the Hope Clinic. Yeah, so financial concerns should not be a worry for you. Okay, we want to take that burden off of your plate. Okay. So what questions do you have for me? Yes. No, that's an excellent question. Yes. So sleep, nutrition, those are also very important. They help with your overall health and well-being. So what you're eating, how much sleep you're getting. So if you're finding yourself struggling with these things, we can also get you access to a sleep therapist and a nutritionist. Is that something you would be interested in? Sure. So let me tell you a little bit more about them. So the sleep therapist is someone you can meet with to talk to about any of your sleep concerns. They'll also be able to do a general assessment of your sleep status and quality. There are some apps that you can download on your phone. They can measure your sleep quality, and then that can be sent to the sleep therapist. And then they'll create a plan of action. So whether you're having trouble falling asleep or staying asleep, or if you're waking up and not feeling refreshed, they can work with you on that. Everything from the quality of your bedding, your pillow, your posture. There's so much that the sleep therapist can do. And we can coordinate that right through the Hope Clinic. Absolutely. As for nutrition, we do find that for some people, when they alter what they're eating, it can sometimes help with some of their health concerns. So if you would like to speak to a nutritionist, they can work out a plan of action for you. Again, something that's rather gentle, something that can be long-term, part of your life. This wouldn't be a diet. This would just be, let's talk about your practices, let's talk about your goals and ways that they can help. So I'm going to give you the name of our sleep therapist and our nutritionist on staff. Yep, and you can consider these referrals. So if you would like to set up appointments with them, you certainly can. And again, this would all be covered under your comprehensive insurance. Yes, as I mentioned, we have a variety of staff at the Hope Clinic. So I encourage you to check them out. Yes, I'll give you a directory of everybody on staff. And please just let me know who you're visiting, because I can coordinate that care, make sure that your appointments aren't conflicting with each other. And then when we have our monthly check-in meetings, we can touch base on who you've seen and how you think it's going. Do you have any other questions for me? Okay, so you can go back up to the front desk, and as soon as your blood tests are in, we'll set up an appointment to meet again. Remember, you are not alone in this anymore. I'm on your side. I'm part of your team, and pretty soon you're going to have an even larger team of professionals that all got your back. You will get through this, right? You will thrive despite this. I am confident of that, and I will help you every step of the way. Okay, it was a pleasure meeting you. I'll see you again soon. Till next time, stay well.